Addiction is a thing. This industry is full of cowboys that will feed into that.
Particular brands that come from arse end of nowhere have bacteria in them.
I want to look like this filter. There's expectation of something which is never going to be achievable.
I think that's where patients go wrong. We see a lot of this in this cowboy market.
And actually people who think they have a high pain threshold and don't realise when it's the really big, butch, muscular men.
And then they've been caught putting makeup on in the waiting room half an hour later. I watch you put trackers on you that beep anytime the makeup comes on. Hi everyone, I'm Dr. Zoya and this is Dr. James from Trikwan Aesthetics, and today we are doing part 4 of our 4-part series on what are you most afraid of when it comes to dermal fillers. And this one's on all the extras, so we didn't have to do a whole long video on each of these. We're going to condense it down and break each one down for you. So we're going to be doing infection, addiction, lumps and bumps, and pain during the treatment. So
you may notice Dr. Sanjay isn't here today. I did his lips just yesterday and I think he's a bit embarrassed and a bit self-conscious because, as you know, post-lip treatment they can be a bit bigger for the day or two, so he's currently in hiding at the moment. But stay tuned, his post-treatment result is going to be amazing. Yeah, we've got a whole video on Dr. Sanjay's lip transformation. Exactly. Stay tuned. So, Dr. James, what's first on the agenda? So, first of all, we're going to talk about infection, and we go into a lot of detail in a minute in terms of what we do here in clinic, and right from the product choice all the way through to the treatment, after treatment, and then what we expect or ask you to do after treatment as well, being the onus is on you. But for now, I know you did some work in terms of the infection rates and stuff. Yeah, so basically we published a paper a few years ago actually sort of describing and sort of publishing the guidelines on how to avoid and how to treat infection. So this is something that you can read that is flashing up on your screen now. And in terms of the risk is very, very low, but it's something, if it happens, then you really want to be with someone who knows what they're doing. And here we have published those guidelines. So James, how do we avoid these infections? Yeah, exactly. So, I mean, this is obviously something people are very concerned about. You sort of, unfortunately, in the news, social media, you see sort of the worst case scenarios. That's the only thing you see. You don't actually hear about all the successful treatments and things. So from the moment you come and see us here in clinic, we start the consultation. As usual, we go into a deep dive in terms of the history, what your aim is, and we ask about anything medication history, your personal medication history, sort of medical history, sorry. You know, these are all relevant things because some medications will increase your likelihood of having an infection. And then depending on the treatments, you know, there's been different types of filler. So a lot of the fillers and other treatments have been found to actually not necessarily contain what they say they're containing, and so, or even be made in, you know, the wrong environment, you know, not a sterile environment. So all the things we use here are clinical, medical grade products, and got from a proper medical pharmacy. So we only use things that are clinically proven, have all the evidence base behind them, and otherwise we wouldn't be, you know, telling our patients how wonderful they are. And then obviously then during the treatment itself, you know, we do everything under aseptic conditions, we clean everything, we give you advice during the treatment, what you should do after the treatment in terms of what you can and can't do, activities. Our post-treatment balm as well actually contains, you know, good antiseptic agents and things, so we do that. And then when you leave the clinic, you know, the onus is technically on you as the patient to adhere to what we advise. You know, not everyone does that, and I know that has been the case a couple of times. For example, we've had patients before that, you know, obviously we tell them after treatment, do not touch the area for a good 4 or 5 hours afterwards, and do not put any makeup on, because obviously the makeup has been in your bag for days and days or weeks and weeks sometimes, and it's been opened, so it contains bacteria on it. So then if you're going to take that and put it on these sort of slightly open needle marks, then you're going to introduce infection to the area. So we get a lot of patients that we explain this to, and actually not a lot, a couple, and then they've been caught putting makeup on in the waiting room or somewhere like half an hour later. Follows you home and watches
I watch you.
Hawk-like eye.
Put like trackers on you that beep anytime the makeup comes on. So yeah, it's very important not to do that. Also, in terms of what James was saying about, you know, certain fillers not being quite good in terms of their infection risk, that's very true too. You've got to know where your fillers are coming from, because there's actually been a couple of papers that have come out very recently about syringes of filler that have been found in particular brands that come from sort of, as James would put it, arse end of nowhere. that actually have been found to have bacteria in them and have caused problems. So again, it's so important to know that you're going to a place that is not going to cheap out on the filler that is being used in your face, and they're going to go for somewhere that has been rigorously sort of tested. We've actually been to Geneva where the fillers are made, and we've seen it go from, you know, just the absolute raw materials all the way through to the final syringe being packaged, and that takes 6 months. And the reason it takes that long is because every step is so meticulously monitored, and that's what we want for our patients.
Absolutely.
So the next one is nodules, lumps, bumps. So all of these are just interchangeable words for the same thing. And again, this isn't super common, but actually, for example, in the lips, in a recent paper that we published, where we were looking at all the complications that have been published in the last 10 years on lip filler procedure in particular, we found that the most common thing that people complained about or had the complication of was nodules, lumps and bumps. And I think there's a lot of reasons for this, and I think it all comes down to a few different factors that James is going to talk to us about.
Yeah, so again, everything, all the complications and all your experience of your treatment all comes down to the same principles of you want to choose someone that is right for the job. And so you've got to choose someone that appreciates the anatomy of every single patient being different. You know, there's no one size fits all. So they've got to know the anatomy, they've got to know the detailed layers, they've got to treat every patient with a fresh approach and just, you know, really realize that. And
yeah, because anatomically, if you place the filler in the wrong layer, you can get lumps and bumps if you place it too superficially, or if you place, for example, too much, too deep. It very much depends on the anatomy of the individual.
There's so much variation. I mean, even like in terms of blood supply, you know, some people may have 2 arteries branching off somewhere or 1 artery branching off somewhere, but, you know, that's important to realize. You don't have to necessarily look for them, the detail like that, but as long as you realize it and just are careful and do your normal medical and proper approach. And then, of course, the technique itself, you know, you want to choose someone, you know, as we said before multiple times, that is qualified, is medical,
and also is up to date with the latest techniques.
Absolutely.
Because actually a very traditional way of doing lip filler is to inject multiple boluses, which is like balls of filler, and of course that's going to result in lots of lumps and bumps, and I think that's why there was probably such a large proportion of people in the last 10 years in that paper that we published that had those nodules. Obviously not from here, this is like a global study of like all complications. So I think now as you know, everything's advanced, techniques have advanced as well, and you've got to adopt those because they lead to less complications, especially lumps and bumps. So if you do other techniques that we do here, you're going to mitigate that.
Which is why it's important to, you know, challenge the norm, which is what you do when you research. You critically appraise everything out there because no one else is going to do it. And if you're doing it, then you can find the best techniques and products and attend conferences, all of which we do. And then, of course, like leading on to that, the product itself, you know, there's over 200 different types of filler. Most of them are crap. And, you know, you want to choose ones that got the evidence base behind them, ones that have enough variety in the type of filler depending on the area you're treating. You know, if you're trying to do volume deep down, you want something with a lot of viscosity. If you want something in the lips, you want something that's going to be moving. You know, your face moves the entire time. A lot of the lumps and bumps occur because most fillers, they don't have that elasticity. So when they stretch, they can often fragment and break up into these little things, and then they become lumps and bumps and migrate, which is why the fillers that we use have got that patent, the only one with the elasticity. So it's got that springing back, which seems obvious, right? It seems obvious that you want to choose a filler that's going to move with your face, but, you know, there's only one that does that, and that's us. So that's we were choosing the right product for that.
Yeah, couldn't have explained it better myself. So the third topic we're going to talk about is addiction. So this is something that a lot of people are concerned with, because I think what happens is everyone's a little bit nervous when they first get their dermal filler treatments done. Then they get a small amount done and they see how much of an impact it can have on your confidence, and, you know, it's something that looks really good and you enjoy. Then the automatic thinking is, oh my God, I need to have more to feel this way, or I need to have more to look even better. And I think that's where patients go wrong. And I think that's where, if you don't have the right practitioner helping you and guiding you and working with you, they can really take advantage of that patient. And unfortunately, we see a lot of this in this sort of cowboy market because it's so unregulated.
Yeah, I mean, this is the thing, like, you know, it's really important knowing when to say no.
100%,
and also trying to be quite real with each patient. Often people come in and there's expectation of something which is actually never going to be achievable. You know, I want to look like this filter. That's a different person altogether. and realizing that's not possible.
Altogether,
of course,
isn't it?
yes.
Yeah,
so then they need sort of other kind of referral onto, you know, a different kind of specialist, maybe to help with things. But it's important to realize that addiction is a thing and it's easily sort of done, and this industry is sort of full of cowboys that will feed into that and just see you as a patient as a blank check. And actually it's important to have someone who's really quite open and honest.
Yeah, and works with you. And I guess the main take home is that more doesn't always equal better. And you really want to work with your practitioner. You want to be with someone that you feel that you can really trust, and they have your best interests at heart.
Yeah. Fine, and last but not least, something which again is really important patients worry about, especially with certain treatments, is pain. You know, that's something which a lot of people have a different pain threshold. Everyone experiences pain differently, and actually people who think they have a high pain threshold then suddenly have a treatment and realise they don't. Often it's the really big, butch, muscular men who sort of feel they have to have that bravado and they overcompensate. But you know, there's no heroes here. Leave your ego at the door, and then what do we do to
actually, I don't think I've ever had a patient that could not get through a treatment because it was so painful. Because number one, most of the treatments are quick. They're not you know, long 1 hour, 2 hour procedures. They're all, you know, mostly under a few minutes. Secondly, we apply very good, very strong numbing cream to the area, which will help numb the region that's being injected. Thirdly, all the fillers that we use have local anaesthetic inside them. So as the treatment's occurring, the pain will get less and less and less. Of course, we have non-anaesthetic versions for anyone that's allergic. And this is something that I guess here at Trikwan we take really seriously as well. And you know, since James has joined, he's also had this feedback from his patients too. And it was one of the main reasons we love James so much, is because most practitioners out there, because we train so many different practitioners, I'd say 99% of practitioners out there have what we call a heavy hand. And a lot of the feedback we get here, without tooting our own horns, is that actually we all have very gentle, soft hands. And that makes such a difference because it's your face, you're awake, you're not a patient who's on general anaesthetic and is asleep. You're awake, you're feeling the emotions, sometimes even more so because you're awake. And you've been thinking about it for so long.
You know, you're there, and it's basically you need to appreciate the tissues that you're handling, right from, you know, the moment you sort of just even cleaning the face and everything like that.
Yeah.
Some people we've seen literally scrub off, and then we've already given a facial just by cleaning. But
and
actually,
they're like moving the face around, and they're doing all this stuff. It's like just talk to the patient.
Exactly, empathy. You know, that's why if you can put yourself in the patient's shoes and treat them as you would want to be treated, and how you would expect your family members and loved ones to be treated,
exactly.
And just realise that it's scary to trust someone with their face, and something that shouldn't be sort of, you know, jumped into.
And we're constantly guiding you through the treatment as well. We go as slow as you want or as fast as you want. It's very much guided by how you're taking to the procedure. And we also use very small needles as well, the smallest we can for the area that we're treating.
That's it. So thank you so much. That was part 4. Is that the final one?
It is the final one, yeah. So
nice,
hopefully we've answered lots of questions.
I've tagged on the end of the last 2, so that's good. I did half the work. But thanks so much for watching. And again, if you have any questions or comments, or you want to see any videos in particular, then pop them in the comments, DM us, whatever. Stay tuned and, you know, subscribe, like, whatever there is, to make sure you don't miss anything coming.
Yeah, great.
See ya. See ya.
See ya.